to the. Thank you, Neeraji. Welcome everybody to the personal integrated therapy for your pain. So I put up some slide to give you the number to contact to join this group, to receive information directly, and to send any feedback you feel. If you feel you feel better, your pain is less, or your pain level is gone down, you can ask questions, or you can ask about. This session will be recorded. It will be available on YouTube. The last session is also available on YouTube.
Jai Shri Krishna.
Right. Welcome, everybody. My name is Prabhu. So we're going to start by asking you to note your pain level. Your pain level can be 0 is no pain, and very high pain up to 10. So make a note of your level between 0 and 10, and then we'll ask you to note it again at halfway and at the end. And you can tell us what difference you feel. So first, I'm going to show you some pain channels which are on your body, in your hands, and on your feet as well. The pain channels are on the back of the hand. These are the channels in between the fingers, and the thumb and the finger as well. These are the pain channels. So you walk along the pain channels. I have to hold my hand like this so you can see it, but you can hold it flat and you can walk along with your fingers. Walk along the channel with your fingers. You can walk down. You can press a little at a time and walk, or just slide down if you want. Then between the ring finger, the middle two fingers. Down. Down. And then between the thumb, and then slide down. And then you press down along the sides of the fingers. You can do it with a pencil as well. Walk along the sides. And same on the other hand, you walk down along the pain channels. Now we're going to start by asking you, so you can follow this video. You can follow every day, whatever time you have, to help to manage your pain. See how you feel. So you're going to breathe in, and then you're going to hold. I'm going to count to 3, and then you're going to breathe out. So you're going to breathe in, hold your breath, 1, 2, 3, and then you breathe out very slowly. Again, breathe in, hold your breath, 1, 2, 3, and slowly breathe out. And again, breathe in, hold, 1, 2, 3, and then breathe out. So we're engaging the brain while you're doing this. When the brain is engaged, it won't have time to send you a pain message. Right, now we're going to hum. Going to breathe in, and you hum like a bee. Roll your tongue up in the mouth, so it makes a deeper sound. You make a deeper sound when the tongue is rolled up onto the top or roof of the mouth. So you got to breathe in and you hum. Breathe in and hum. Breathe in and hum. Again, breathe in. One more. Now we do another breathing exercise. Now you're going to breathe in and then you're going to breathe out, and then you breathe out and you hold your breath for a count of 3. So you're going to breathe in, breathe out, hold 1, 2, 3, and then you breathe in, breathe out, hold 1, 2, 3, breathe in through the nose, breathe out through the nose, hold 1, 2, 3, breathe in, breathe out through the nose, 1, 2, 3, and we do one more. Breathe in, breathe out, and hold 1, 2, 3. So pain may be sharp or dull. It can be sharp or dull. It may come and go, or it may be constant. Some people have constant pain. Some people get pain at some points, and then it lasts for a little while, then it goes away. So hope during this therapy, the constant pain comes down. So you got to stretch your hands in front of you and you open and close your fist. Hands straight, elbow straight, open and close the fist. And then your palms up and down. Keep the hands straight. Palms go up and down. Hands straight. Feel the pain. Feel the pain. Elbow straight. Hands straight. Elbow straight. And next, you make a fist, and then you rotate the feet. Rotate the fists. Elbow straight. Feel the pain. You feel the pain, the relaxation from the neck all the way down your shoulders and all the way down the elbows towards your wrists, your fingers, and thumbs. Very simple exercise, but you're exercising all the way up to the neck and shoulders and the top part of the back. Then you go in reverse. Now you got lymphatic fluid throughout your system in the body, and it has no pump. It stays in the body. Only when you exercise this, the lymph fluid moves up. It moves all the way up to your groin and then escapes, and then it moves all the way up to your armpits and escapes from under the armpits. Now there's a lymphatic point, 3 fingers below, 3 fingers below the wrist. That's your lymphatic point. You press it and then close your fist. You're pumping the lymph fluid. And then with the other hand, same, 3 fingers below, open and close the fist. Now stress can play a major role in chronic pain. If there's stress, it adds to the pain. So it is important to reduce the stress. So we hope your stress level goes down in this session. In this session, while you're busy, your stress level should go down, your brain should relax. So now we do some breathing. We do some deep breathing. So you inhale through the nose. So breathe in through the nose, fill up the lungs, and then breathe out through the nose, mouth closed. So as you breathe in, the lungs expand. The extra oxygen is going into your lungs. When the lungs expand, there is more capacity for all the cells to absorb more oxygen. Because the surface area of the lungs goes up, and then more oxygen is absorbed, and then you breathe out, more carbon dioxide goes out as you breathe out. So do some deep breathing as much as you can and slowly. And then breathe out slowly, not fast, very, very slowly. So brain is engaged in doing this activity and it feels happy when it's getting extra oxygen going into the brain. So oxygen goes into the lungs, then into the heart, then into the bloodstream, and then into the brain. And to all the cells in the body. So with the extra oxygen, you're repairing your cells, healing your body. Long, deep breaths. Next, we stimulate the pituitary gland, which releases a lot of hormones to help in repairing your body, functioning of your body. So you join your 2 fingers and then rub your forehead up and down. Just stimulating the pituitary and pineal glands. You can do it 1 finger as well, but with 2 fingers, it's easier, whatever. And then on the sides of your head, sides of your brain, there are little dimples here. Find these 2 little dimples and then you rotate your finger. Very relaxing. It is good for a headache as well. Tension, brings down your tension. Then you go down in reverse. And then at the bottom of your nostrils, bottom base of your nose, you rub this point. This is good for sinus. The sinus will cause a little discomfort, and it may cause pain as well. So you rotate this, clears the sinuses. Little massage one way and then go in reverse. Next, we do some alternate nostril breathing. Both your nostrils are different. It's important to breathe through each nostril. During the day, you'll notice that one nostril is closed. You're using one nostril even at night. You'll find that one nostril is closed, only one nostril is working. So we're going to use both nostrils to breathe, but we're going to close one nostril at a time. So we close the right nostril with the thumb, and then the other nostril you can open and close with one or two middle two fingers. One or two middle fingers. Just a gentle press to close the nostril. You don't need to squeeze the nostril, just gently. So you press the right nostril, you breathe in through the left nostril, and then close the left nostril, breathe out from the right nostril. Then you breathe back in from the right nostril, close the right nostril, and out from the left. That is one round of Anulom Vilom, alternate nostril, Anulom Vilom Pranayam. The breathing techniques, we call them pranayam. So we do this for a little while. So in from the left nostril, out from the right nostril, then breathe back in from the right nostril, and then out from the left nostril. So continuously, long deep breaths. You feel the oxygen going up into the brain. It relaxes the brain. You breathe into the lungs, feel the lungs expanding. And you feel the brain calming down as you do it more and more. Concentrate on the third eye in between the two eyebrows. In from one nostril, out from the other nostril. After you breathe out, you breathe back in from the same nostril. Very, very relaxing. As the extra oxygen goes into the brain, your stress, tension, anxiety, depression comes down slowly. So you do this regularly, minimum 5 minutes, then you can go up to 20 minutes. You can do it twice a day, 3 times a day as well. Anytime, you can do it anytime, any place, anywhere. And it's suitable for everybody. Children and even pregnant women can do it. Very relaxing. Even in your hospital bed or at home in bed, if you can't do anything, you do this alternate nostril breathing or just deep breathing. If you can't use your hand, just deep breathing through the nostril, fill up the lungs, and then extra oxygen will help with the healing process. The extra oxygen going into the cells, each cell, the healing which will be much better and quicker. This is a practical session. So if you follow it for whatever time you have and feel the difference. Alternate nostril breathing. Oh, at this point, we'll just rub your hands, generate some heat in the palms of the hands. Then close your eyes and place your palms on the closed eyes. So the heat from the palms will go into the eyes. Eyes feel much better when you apply some warmth. And then slowly open the eyes and bring yours down. Now, you need to place your hands on the shoulders, join your elbows. You can rotate the elbows. It will reduce a lot of tension. So elbows go up, back, stretch to the back, and down. So you breathe in as the elbows come up. Breathe out as elbows go down. Feel the tension coming down. Very, very slow. As you expand the muscles, you stretch the muscles, elbows going all the way up, and then try and stretch to the back and down. So breathe in as the elbows are going up. Breathe out as the elbows are going down. So many muscles around your neck, your shoulders, your upper back. And then you go in reverse. So breathe in as the elbows go up. Breathe out as the elbows come down. The brain is engaged in coordinating your movement, remembering to breathe at the right time, breathing in as the elbows go up. It is to remember to breathe down. You're keeping the brain active, telling it to do so much, synchronizing. Right. Next, you're gonna massage the knees. You massage your knees, then move your palms around the knees, and then you rotate the shoulders. So your shoulders go up, backwards, down, forwards. Big rotation of the shoulders, very, very relaxing. At the same time, your palms are massaging your knees. Elbows going up, back, down, forwards. Big circular motion with your shoulders. Then we go in reverse. Shoulders coming up from the back, going forwards, and then down, going backwards, up. So breathe in as the elbows are going up, shoulders are going up, and then breathe out as the shoulders come down. Breathing coordination with the movement. So brain is supplied with oxygen all the time. Oh, now we do some humming. Breathe in and you hum. Now at this point, you note down a pain level. Your pain level between 0 and 10. At the beginning, I asked you to note down your pain level, and then you note it down at this point in time. See how you feel. It will be good for your own notes to see how you feel with yourself, and then you can tell others as well. Next, we need to do another breathing exercise. It's called Kapalbhati. In Kapalbhati, you're blowing the air out from the nose. You're blowing your nose like you blow on the tissue. So you throw the air out from the nose. Just blow the air out from the nose as if you're blowing your nose, blowing into a tissue. As you do that, the stomach contracts in. The stomach moves in by itself. You do not move the stomach. The stomach moves in by itself. This is not to be done by pregnant women or if you have surgery in the last 4 to 6 months. The stomach contracts in. The breathing in happens automatically. After you breathe out, in the half and quarter second, the body does the breathing in automatically. Because you create a vacuum, the breath goes in automatically. So you breathe out. In between, the breathing is happening. You don't know. So your part is to only breathe out through the nose. One stroke per second. If you feel tired, if you feel dizzy, you stop. Resume in about half a minute or 1 minute, whatever time it takes. You'll get used to it. Do this on an empty stomach. So breathe out. The purpose of this exercise, breathing technique, is to squeeze your organs as the stomach contracts in. As the stomach goes in, you're squeezing your organs, your liver, kidneys, pancreas, uterus, ovaries, prostate, spleen, gallbladder, and your master gland, the thyroid gland. Air is passing next to the thyroid gland, so you're stimulating thyroid glands as well. So this is your body software. You're exercising the body software. As the organs become healthy, your immune system becomes strong and helps to fight off any diseases, any medical conditions you have. When the organs are healthy, the body can fight off any type. So the aim is to make your immune system strong to fight off all the conditions which affect you, because pain is a result of some other thing. If you're waiting for surgery, knee pain, head pain, shoulder pain, operation pain, post-operation pain, lots of different types of pain happen, and all you get is painkillers, and they stop working or they give only relief for 1 or 2 hours, and some of them stop working. So all these are techniques to get your body into shape, get your body healthy, and to fight off any medical problems you have. So you do Kapalbhati. So you do this for 5 minutes minimum, and then you can expand it to 20 minutes. And then 30 minutes, and then 1 hour as well. Do as much as you can and feel the difference. And if you got diabetes, we can squeeze the pancreas. We can squeeze the pancreas by making a fist. You close, thumb goes in, close the fist. Both fists go on the stomach. Then you breathe in, then you breathe out, push the stomach in, and then you do this Kapalbhati again. So with the fist put in, we are doing extra squeezing of the organs, including the pancreas, and then you do Kapalbhati. You can do this sitting down, or you can do bending forward. Then is extra squeeze on your organs with the fist pushing in as well. We're squeezing the pancreas and the other organs. So it's double benefit with the stomach doing the pushing in, the stomach doing the pushing and squeezing of the organs, and the fists helping as they are pushing in as well. Double pushing of the organs, squeezing of the organs, and Kapalbhati. So Kapalbhati is helping, fists are helping. And if you bend down, there's an extra squeeze, 3 types of squeezing. So practice this for 10 minutes. 10 minutes, do that as well. So you sort your other problems as well as your pain level, and then you're sorting the other problems at the same time. Now, I'm going to show you some other points, because when you do all these exercises, you generate a lot of toxins. So toxins collect in the kidneys. So your kidney point, these are acupressure points on the hands. Several acupressure points for different organs on the hands. And this is the kidney point, and the middle of the hand is your kidney point. If you have a problem with the kidneys, you'll feel the pain. So press it with a thumb or a finger to process the toxins. We have generated a lot of toxins. They'll accumulate in the kidneys, and you help the kidneys to process them. So you can do this 2 to 5 minutes. And same with the other hand. That's your kidney point. So you can do this with a thumb, or you can do this with a pencil as well. And then if you have back pain, you can press this webbing in between the thumb and this finger. So you can press it here on the base of this index finger, or in the base of the webbing. You can press that. This will be a very painful point. And then again, the base of the thumb. The 3 points here. You can press all those. This will help with back problems, headaches as well. All painful, but you can press it, or you can press it just like this with the thumb. And you can also press the tips of the fingers. These are very good for sinuses, sinus points. Thumb, tip of the thumb is your brain point, pituitary gland. So all these points will be pressed. And then we do a little laughing to release your tension. And you go, ah, ha, ha, ah, 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 and then you do some clapping. With the clapping, you are pressing your acupressure points. You go 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3, 1, 2, 1, 2, 3, 1, 2, 1, 2, 3, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. Then press on the palms. On the palms, you hit twice, okay? You're stimulating several points here. 1, 2. Other hand. 1, 2. On the back, all your pain channels. 1, 2. Other hand. 1, 2. On the side also is useful. 1, 2. Down along your bottom of the palms. 1, 2. Oh, thank you very much. Now check your pain level again. And that's the end of the session. You can watch it again and then see how you feel. You can tell me now, everyone, what sort of pain level you have got.